The next time you are going to see me, you are going to be on your bed, you will be awake, you will be the best version of yourself.
Wow, okay. So there's another part I would like us to talk about.
Yeah.
The common fears people have before surgery.
Very important.
You know, that's really holding a lot of people down. And even from the consultation, some people even come and their blood pressure is already shooting up. Once they enter renew, it's like, oh my God, it's like the surgery is happening now. Meanwhile, the reason they've heard some things online, they have these fears in their hearts that they're like, oh my God. So let's address a bit of that, right?
Very
so from
important.
my own experience, what I've seen, the number one question people or number one fear people have is if they would even wake up from this surgery. That is the number one, like always from the consultation. Doctor, will I wake up? So it's like the anesthesia part of it. A lot of people are worried about that. Yeah. So what do you have to say about that, Maswini?
No, I want Dr. Malu to speak. Yes, I will support.
Well, I think that's a very important thing, the fear before surgery. And the fear is not just from the patient, it's also from the relatives, the supporters. You understand? And I think the people are always concerned about telling is their relatives.
Exactly.
They usually will say, look, I don't want to tell my relative because they'll be so afraid, they think. And it interests me that people are not afraid of going for appendix surgery, but they are afraid of going for liposuction with BBL. And again, it's because of the societal correlation. They say that BBL is vain, so maybe God will use the opportunity to punish you. God does not kill people, by the way. God doesn't kill. So, and I got a lot of media attention when I say that BBL is safer than CS. You understand?
They help you here.
And I still maintain that
Your
position
stand.
because if you are going for CS, first of all, the person is pregnant, the whole system is not working
different.
properly. The system is different. So the risk of surgery is much, much higher than if you are going for BBL. If you are going for BBL, you have to be medically fit. You have no medical condition. If you are pregnant, we cannot do a surgery for you. Even if your blood level is low, we cannot do your surgery for you. But if you are going for CS and your blood level is low, they will still do the surgery. They will just transfuse you and still do the surgery, especially emergency CS. So the preparation for surgery for CS is actually much, much more and riskier. The factors that the doctors have to deal with for CS are much more than those that they have to deal with for lipo. Yes. So if you remember, I said earlier on that preparation and the surgery are the most important. If you don't do a good preparation, that is when you have complications. If you do a good preparation, then the complication level drops down. But there are some factors you cannot change in somebody going in for a CS. But for lipo, I mean, if you're not fit, I'll just take a cup of tea, drink, and say, sorry, come back next 3 months from now. You may be upset, but I mean, you come back more fit.
Yeah.
So preparation is easy. So people going for BBL are already medically fit. Their risk level is very low. If they have a medical condition, maybe like high blood pressure or diabetes, it is controlled before they go for surgery. Whatever problem they have, it is taken care of before they go for that makes it safe. You understand? Now, whether you are going for CS or appendectomy, these things are mostly things that must be done.
Yes.
You understand? Now, the surgery itself, in BBL, we don't enter into the abdomen. It is, yes, removing fat is a wide surface area, but we don't enter into the abdomen. In CS, they enter into the abdomen. They cut the skin, the muscles, they go deep in. You see intestines and everything to bring out the baby. And bleeding could even be much, much more, you understand, compared to liposuction. Liposuction is more controlled. In surgery, we classify surgeries into clean surgeries, clean contaminated, and dirty surgeries. Now, CS would not be classified as a clean surgery. It will be classified as a contaminated surgery. So it's not clean, contaminated, it is contaminated. Liposuction and BBL is a clean surgery. So even in terms of risk of infection, the liposuction is much, much less infectious. We just give antibiotics for prophylaxis. it is actually a clean surgery because we don't enter into any bowel lumen, we don't enter into any viscous. Then the aftercare of these things are also different. So I've just highlighted a few things that make liposuction and BBL very, very safe, because the BBL liposuction is more controlled compared to CS. So the safety issue is not something that people should be worried about. I'm using this example of CS and lipo and appendectomy just to make people relate to the fact. It's not comparing whether for reasons, because I know that when this goes up, people say, Dr. Malu, how can you compare CS and BBL? Don't you know that this is a valid? No, the reason is not the issue. We're talking about safety. So if you or your relative is going for this, you should think about the safety, and the safety of liposuction is actually more for these factors, for these reasons that I have mentioned.
And also I would agree when you said that people are actually worried for their relatives. The fear comes from there. We had one case where we're about to enter theater. Her mom was calling that she had a dream last night that she should not go ahead. Should not go ahead with the surgery. Her sisters, the patient was just going through a lot at that point. And she just prayed, dropped her phone, went into the surgery, and came out, and she was fine.
I'll tell you another story.
Okay.
This one, she knew that the relatives would be worried. She's a married person, and she knows the relatives will be worried, and she decided to work with her close friend. So on the day of surgery, and this lady will have been preparing her for like 6 months for surgery. So when she got ready, I said, all right, this is the time to go in. Then when she came to the hospital, the relatives suspected something, and they started tracking her. They were driving, they were following her like a police. You know the way police search.
Oh my goodness!
And she too, she with her friend were
trying to escape.
It was so funny. They were chasing her like you see this. What do you call it? When police chase the robbers. Police chase. Police that is what we're doing in Abuja. So finally, they dodged and entered into Renew. And then they also got into Renew. And the patient was in, and of course, by the policies of Renew, we don't just allow you access to the patient. So the whole relatives, the children, everywhere
was full.
So we have to now talk to them and say, look, this is not as bad as you're thinking, but it's the patient that can only tell you what she's doing. She's the only one that can tell you. So after proper counseling and explanation, they got to accept. You understand? And guess what? When she came out of the surgery, she turned out so well. She looked so beautiful. So the fear is there, and it stems out of ignorance. I won't blame people who are afraid. They think that the noise about it is so it's a lot. So it's enough to scare somebody who is not informed. But if you go to plastic surgery pages, I always emphasize go to plastic surgery pages, plastic surgeons pages, and hear the surgeon explain. Listen to the doctors. If you listen to somebody, you know whether the person knows what he's doing or not.
Yeah, so I know the fears are, some of them are very dramatic and funny. We see a lot of them. Because some people waking up, the first thing they ask, am I alive? I say, you are not asking me. did I wake up? Yes, you are here. That's the more reason why you're asking me. Asking
they can't believe it.
And we had a case. This person went to stock her fridge. In case she doesn't wake up. But she was she
wrote her will.
Everything.
She wrote her will too.
I've seen that one too.
Did everything. Handed over her ATR cards to her.
I heard that.
I wish she gave me the
handed her card and everything, and I said, but after doing all, but you are still here.
You brought
yourself here. So the fear. I asked her, and she was explaining to me. I said, so what's the reason? She said, in case she does not wake up, so that her children, she's thinking about her children. So it's just, I feel that it's...
Did she wake up?
She did I wake up?
I think there's one that came, I think she just came in from the US or so, and she had all kinds of stories. In fact, I almost cancelled her surgery that morning because when she was asking so many questions, because I said this question should have been asked earlier. The very fact that you are this anxious close to surgery, let us just shift the surgery. Because usually if you are that anxious, for the very fact that you are very anxious, we could shift your surgery. We're not bent on doing your surgery. There's no emergency, but there's no rush. I mean, we're here, we'll still do your surgery any day. So I almost shifted the surgery, but she said no, that okay, we should just go ahead. And we went ahead. I look at her now, she's bouncing everywhere.
So, Dr. Malu, why don't you operate on celebrities? I've actually seen that question on one of our comments.
Okay.
Yes.
So why? Is there something?
What do you think, sir?
No, sir, wait first. Because a lot of, even last week, a patient asked me, I've never seen celebrities come here. What's the reason? Because celebrity can influence a lot of people. Bring traction.
Well,
so why don't
the truth is, we have our own kind of celebrities. Renewed celebrities are usually very quiet people who have a lot of, our kind of celebrities are usually people who are private individuals who are not out there in the social media. Actually, they are private people who well-respected people in society. Those are the kind of people that we have. I noticed something with the popular celebrities.
Okay.
It's not that they've not contacted us. Incidentally, a lot of those who have done surgeries elsewhere actually consulted Renew. But when they saw our
invoice,
invoice, we didn't hear from them again. I know one in particular who had a consultation twice, and she actually wanted us to use her as an influencer. And I said no, that we don't want to treat values. That we prefer people on their own to share their stories. We don't want to pay you to share stories. And that is what we do for everybody. We don't pay people to share their stories. We allow people to share their stories themselves. And she wanted to come with her whole media team to do all that. I said no. So she really liked our work, but she was not able to pay. So I'm not saying that all the celebrities are in that category, but a good number of them actually find our bills on the high side. That's one. The other side is a lot of them do it for show, and Renew bodies are not the loud bodies.
Natural.
Yes, Renew bodies are those people who want it natural and beautiful. If you look at a Renew body, you know that they look nice, but you have to second guess to know that do they really do something to their bodies? Now scarless. That's why we invented the scarless technique, so that you can undress and nobody will see that. And this reminds me of a story. There's a lady, she's from the north, by the way. Okay. I've operated on hundreds of people from the north, so it's not one person. And we did a scarless libel for her. She's very close to her dad. And so she told her dad she was not feeling fine. I didn't know. It's later she told me. I was not part of the conspiracy. So the dad, and I hope I'm not exposing these people now. Let me just put that. So, well, by the way, she went ahead, she had her surgery. And the family members didn't know so much about it. She told me they didn't know. I thought they knew. She told me they didn't know. So when her mother was suspecting, why are you looking so curvy these days? You look so, what is going on? She told me that she now went angry. Say, what do you think? Her auntie said, maybe she did surgery. She said, no, I didn't. Let me undress, you will see. So she undressed. She said, where is the scar? Where is the scar? She was ready to undress to show them that where is the scar? Because we actually use the scarless technique. So I was just laughing. So I'm not saying people should not tell their relatives. I think you should involve somebody in your family. Yes. At least one member of your family should know that you are doing your body. But I think that is the explanation for the celebrity side. Okay. Yes, they don't fit into the classic popular celebrities who are on social media. They don't fit into our Renew kind of clients. Our clients are private. They love things that are natural, beautiful, and they're not loud.
Okay. Yeah. Have you ever had any case where someone wanted you to do it for free for them just because they're a celebrity in exchange for maybe?
Yeah, we've had. I'd say that's what I'm saying. The same thing I say. Some people want to think that they can trade their popularity
Content.
for surgery, but we don't want to do that because we say, look, it should be voluntary. Sharing your story should be voluntary. We have so many people who have done their bodies, and we don't want to compel you to share your story for money. In fact, we cringe at people who say, give us money and we'll share our story, or we'll do. All the people you see sharing their stories on our page, we do not pay them to share it. None. Beginning from as far back as 2018, if you go to the new page, you see a lot of people sharing their stories. We don't pay them. They just on their own. I love to share my story.
And another very important one, right?
Yeah.
So how are you able to handle thousands of women?
Mm-hmm.
You have seen different shapes, different sizes, and then you're still able to still be normal. I don't know if that's
Incidentally,
how do you do that?
And but let me add, I've observed. I think about it
Too,
on,
right?
on his behalf.
Okay.
And I
Yeah.
think he has developed the psychology. At times he doesn't even remember them when they come. Most of the time. So you
there's
can
more
see
to
that
it.
it's a good mindset, and
He's
you understand?
able to balance it.
Able to. It's not as if he's forgetting, but he's not focused on. Do you
The
understand?
women is focused on the job,
On
the
the
health.
job, yes, on the health. It's not like he's forgetting
She
his
helping you.
patients. It's not like he's forgetting his patients, but
Yeah.
you could see that that's the word, the
Very
professionalism.
professional.
Yes, so it helps the cycle. I've seen it a lot because when somebody come and say, "Who is this?" You
You look so good, you cannot remember them. You're casting it now.
actually, they are because I've had people say, Dr. Malu, you mean you cannot remember me? I'm disappointed. Well, the truth is, the medical profession is a profession of empathy. Empathy means you should, when somebody comes to you, they need your services, you should have a level of pity for them. And I think that I developed that right from my medical school days, where I see clients as problems to be solved. So that's personal. Okay. When I see people, I look at the problems. I think of the solutions. I'm so engrossed in thinking of the solution that I don't even think there's something else to that. And then the professional aspect, which requires that we should always have chaperones with us.
Very important.
It's not just for me, it's also for the ladies. It's two ways, you understand me? For them to be comfortable. So we always have another lady with us whenever I'm seeing a patient. I don't see patients alone. And I think that should apply to other doctors as well.
Okay.
You will never see me seeing a patient alone. I will always see a patient with a medical colleague so that the patient is comfortable. And I think for me, it's never a big issue. I mean, you see thousands of people just like it, literally thousands of people.
Yes.
So how can you be focusing on other things? You just focus on the problem, find the solution to it, and let's go. It's so serious that people have done consultation with me last week and have contacted me the next week to ask me a question, and I don't remember them. I don't remember them. I genuinely don't remember them. And I say, can I please, I'll have to do it. This I cannot hide. I have to examine them again.
To remember.
Yes, I may make out that, okay, I think I've met you before, but the particulars, I may have to see you again. And I think it's just normal for practice, for medical practice. You do it so that it becomes your second nature.
You're doing a good job, though. Okay, so another one, right? So for the patients that do this for their self-confidence, do you think after the surgery, it actually helps them truly? They get their self-confidence back after the surgery is done fully?
100%. 100%. 100%, I would say that. I mean, some people, you cannot really have this experience until you've done your body. I mean, you were a witness yesterday when somebody came into the country and she insisted on meeting me. I was very busy, but they dragged me to go and see her. And why did she want to see me for? She just wanted to say thank you for her surgery that we did. So that experience of transformation, and I didn't remember her, just she came to tell me thank you. I did not remember her until she told me, Dr. Malu, don't you remember the woman that had a long scar and they told me? I said, okay, because I know it was a difficult procedure, but she was looking really, really
amazing.
Good. Really, really good.
For me, I always look forward for the follow-up, especially because
The 4 weeks.
the
4
weeks, the energy they use to come
different.
upstairs is different from the one they're working. They used to work in when they are coming in. They are mostly happy, hugging all the nurses. We greet them, and you could see that the confidence is there. And yes, some of them, the things there's some of them even have pictures of the clothes. They'll be showing you, I've not been able to wear this one.
But now
I can wear it. So I think the confidence is mostly restored after the surgery.
Yeah. Now let me ask you, you are in the ward. I mean, what's your experience about naughty clients?
Ha ha.
Tell me the things that patients do to you.
Yes,
You will talk of the doctor's side, and then she will talk about what they do to them. What do patients do to you? Tell me.
I don't
We'll
even
not
know
talk
where to
about
start
that.
from. I don't even know where
Just
to
tell us,
start
because
from.
you guys are always smiling. What I
Yes.
observe that you nurses are always, renew nurses always smiling, always smiling, always smiling. I've never seen you guys frown. Is it that the patients are that nice?
They're all wonderful.
No.
Tell me what they do.
Like I always say, we also have it's like we after maybe Dr. Malu will organize a mental retreat for
Is it that bad?
Yeah,
It's not bad.
it is putting your emotions
Oh, you guys are
behind.
having, yeah, exactly. Yeah.
For someone else, it's not a joke. Yes, and I feel it's like Dr. Malu said, the empathy.
Very important.
When you put yourself in someone's shoes, help you do the job better. You know, we can after work we can go back home, but when you come, you see, I've never had the procedure done, but I could see the pain people
they are going through.
The people they express from the pains they're expressing. So from there I can understand that this is so. No matter what they throw at me, it
Tell us the
yes.
things through it at you. Tell us in yes.
Okay, tell us one.
Tell us about the things, not one. Tell us the things that they throw at you.
That a lot.
Yes,
that
tell
a lot. But you know, it's someone that is sick.
You are forgiving them. Oh yeah, tell us. Let us list them. What are they?
So, you know, whatever goes wrong in the ward, first fall on the nurse.
Yes.
If the food doesn't come well, the nurse receives it.
Okay.
If light trips up when you're supposed to, the nurse receives it. If the AC is not working, the nurse is at fault. And then
TV is not.
Yes. So the and some of the time they after they have done their body, you can come with then the nurses are body shaming they body shame the nurses. You are working here.
Let's
Yes.
talk about that.
Okay.
Yes.
Why are you looking so fat?
You are working
That's
here.
how they say it.
And your tummy is this big. Yes, this is body shaming.
Yes, so.
But these are the best people taking care of you. Yes. So I don't even know where to start from because there's a lot. They do. Some people do a lot. Why some are very wonderful.
Yeah, we
Some
have
are
a lot
very
of that.
Yeah. Some are very wonderful.
There's something
some
my
isn't.
there's something my pastor used to say. He say hurting people hurt others.
They
And-
project.
Yeah, hurting people hurt others. So some people's way of handling situations is to transfer it to the people who are around them. They are not really bad people. They just maybe they've grown up thinking that if I'm hurting, I should transfer the aggression to somebody else.
Yes.
So the discomfort they feel after surgery, they transfer it to the nearest person who is the nurse.
Like me personally, the experience I had, someone calling me names, and I was about to give her a certain care.
Yeah.
She called me vulgar names,
Oh my
sent
God.
me out of her room. I was in tears. I was holding it,
Okay.
still giving the care.
Oh my God.
So it's
Look at what healthcare providers go through.
My dear. Especially
Yes.
in Nigeria.
Yes. So and no, I don't know how to. I don't know where to start from. That's
Have you ever
this is a
thought
lot.
of quitting? Have you ever thought of slapping?
Every
people?
day, every day you come out and you're like, God, this is what you go back in and do. And funny enough, but one funny thing is before some of them they realize what
They know what they've
did.
done.
Okay.
So before they go, they're like, we are just
So
all
sorry
happy
for
about
this
it.
and
So
all
sorry.
that.
And then they're all nice, but we go through a lot.
But do you know the interesting thing? No patient has ever reported the nurses to me. Which means you guys are handling it very, very well.
Do they report doctors?
No. Tell me, let me hear what you guys do.
Okay, so from my own angle, right,
Yes,
from the doctor's end, I feel like some people still struggle with the trust. Like if they're coming to Nigeria to do their body, or they still struggle to trust Nigerian doctors at some point.
Yeah.
I feel some people have that. So that trust affects what you're telling them. So like example, the nurses can call us now. This patient said she wants to speak to a doctor, right? And then you go to the room, seeing the patient, and the care you want to offer or the advice you're giving, they still feel like
There's something.
it's like they'll carry ChatGPT. They still feel like there's something left. They'll legit browse what you say to confirm if it's correct before they know. So we have that struggle with some patients, especially those coming from outside, right? And I feel like people need to know that Nigerian doctors are superb.
Yeah.
We're the best. Wherever you see Nigerians, they are going to stand out.
Nigerian
And that's
care
the same
providers
thing
generally.
in the medical field. We are good at what we do. That's why we're still standing here. So just try your best to trust your doctor.
And I would like to add again, you know, the issue with nurses, people complain of nurses attitude, the general hospital nurses. I already know there's something like that. So most people come in with that mentality.
That are meeting that
Yes, they are going to meet that kind
Difficult.
of. In fact, there was a patient that came in. She came in, I think, from the UK, and from the had the next day, the first day post-op, I heard her making the call. She said she don't come now. She do. I'm waiting for all those nurses.
Difficult
Anybody try me? I was standing there. Yes. Anybody try me? She was making a call, and I looked at her. It made me. I gave her my best. I wanted to defeat that.
You don't even need to make
Why not like that?
No,
That's
it's just. I said no. I don't need to give back that energy. I need to. And before she left, she confessed. This person, these people are not. These ones are not like this. So these ones are not like this. So and I was able to. I thank God I was at the end of this. So I think other people come with already
that mindset that they are
that's
going to see
difficult people that are coming from
caregivers.
outside. Nigerians are like the Nigerian nurses are like this, and
We're not like
it's
that,
not it's not renewed
over here.
It's not renewed. So
and credit to Nigerian to renew doctors. I mean, again, they don't complain to me.
About doctors.
The patients don't complain to me. I mean, you guys are doing an amazing job, I must say. I think I receive my own challenge with the patient is those people who send me, who have access to my private number, and they send me messages around
3 a.m.
around 11 p.m. They have a knack for sending messages between 10 p.m. and 12 a.m. It's like that is, I don't know, maybe some of them,
That's when they are relaxed.
That is when they are relaxed.
They are relaxed, they are done with work, they are chilling in their bed.
Then they look at Dr. Malu. Dr. Malu, my bum has disappeared. Dr. Malu, this swelling, they're 2 weeks, just 2 weeks. They're just 2 weeks after surgery, 3 weeks after surgery. Dr. Malu, I cannot see my bum again. Dr. Malu, my hips have disappeared. Dr. Malu, this compression garment is too tight. So, that is one of the toughest things. Or they ask me some very, very nonsense questions.
Like which one?
That's part of the questions now. I mean, things that we have told them over and over again.
Yeah.
You understand? It's not about trust.
Okay.
I initially used to be upset about it, but I discovered that it comes from all of them. So I took it as just seeking for information.
Okay.
And I will not answer them. Of course, it's too late. I'll not answer. I'll wait till tomorrow during work hours and I'll send a message. Okay, fine. If you have any complaints, just come to the hospital. And I say, oh, no, I'm okay. and the hospital is open 24 hours a day, so
there's always a doctor on ground, nurses.
So they are normal human beings. You understand? They are normal human beings. What we're experiencing is not different from what other plastic surgeons around the world are experiencing. It's the same thing, and it's the same thing like any other business. People will complain, but those who understand good things know that we're actually offering them the best.
Yes, and we have a lot of that here too. We have very wonderful patients.
Yes.
Oh my God. Yes. Okay, so another one, right? I noticed lately, like, people are really comparing their bodies to people they see online. Like, when they come now, they have an image that will say, Dr. Malu, this is what I want. This is what I want you to do for me, right? But they don't have that frame.
yes.
They are not as tall as or short or, these things
Straight
differ.
legs.
Yeah. So if it's not this body, they are not going to be satisfied. So that's the image they now carry in their head. That's what they expect to see when they wake up.
Yeah.
And when they don't see that, everything goes left.
Yeah. I mean, it's part of the challenges of the healthcare profession. When I started in the early years, I used to be. I mean, I've given my best to you, and then you are comparing yourself to somebody else. I used to be upset until I started studying the kind of people that come for surgery, and I discovered I classified them into different types. I mean, this podcast cannot talk about it. A book is coming out about the liposuction and BBL.
Wow. Okay.
Yeah, that I'll talk more about the types of bodies. But at Renew, be able to classify people, I'll discover that there are a particular group of people that are like that. It's just their personality. You cannot change it. They don't have that frame. That's why they even want to come for surgery. So they think that surgery is a place where you can manufacture somebody afresh. As they enter the theater, they're entering one machine like that. You break their bones, you remove their muscles, and then you will just fix them and they come out the way they want. So I've tell people say, I want to look like Faith Success, I want to look like Hilda Bassi, I want to look like this person,
Beyonce.
I heard you did this person's body, I want to look like Beyonce, I want to look like this person. And I said, look, you are going to be the best version of yourself. They say, but you did it for this person. I say, yes, she is the best version of herself. She's the best version of herself. And we keep repeating it, hoping that some will get. Most people, many will still not get it. But the reality is that no two people on earth are the same. Everybody is different. And you will just come out a better version of yourself. So expectations need to be realistic. Some are really not realistic. That's the purpose of consultation. We see them during consultation. When I see them, I tell them, this is where the challenge is. This is what I think we can achieve. I think we're going to have a challenge here. But overall, you are going to be the best version of yourself. Yeah.
So, at the end of the day, right?
Yeah.
What do you think is most important for someone considering surgery? Like, if I say right now I want to do surgery, right? What should I be thinking of most?
Maybe she'll start.
Yeah.
Okay. We've covered most of
The topics, right?
Most of the topic, and I think we've said most
of the things.
Yes. The reason why you should be considering, are you insecure about something? Do you want to?
Maybe let me rephrase the question, right? I'm saying if someone is considering doing a surgery, what should they focus more on?
Safety.
You get it? Safety.
Dr. Malu,
Okay.
Dr. Malu has a slogan: safety, safety,
Yes,
safety. Yes. So I believe, like for Renew, if you come to Dr. Malu, you get the best care or the best version of yourself. But after it, safety. And when you come out, whatever, I believe it gives the best.
Yes.
So yes, at the end of, I'm talking based on
Your experience.
yes, and then based on our Dr. Malu. Yes.
Renew doctor, renew.
Renew doctor, yes. After I don't know how to put it.
Okay.
Yes, I don't know how to put it, but I feel coming for what you want to do, if you have made up your mind on what you want to do, just know that we Renew the safety, you get the best version of yourself, and at the end of the day, you'll be happy with your results.
Yeah.
I like that.
That's it. I mean, Winnie has said everything. I mean, safety. And you should know that it's simple. It's simple. People say, oh, Dr. Malu, you make it look so simple.
Yeah,
because it is simple. It is simple. It is simple to me. My whole life, I don't like complex stuff. I like simplifying things. That's why I came up with the scarless liposuction. That's why I came up with the scarless tummy tuck. That's why I came up with natural BBL. They are all concepts that I derived myself.
Of course.
And they've proven themselves over the years to be excellent. Because I don't like making things difficult. So, if you come for surgery, just think of safety. And when I say safety, trust the doctor.
Yeah.
Trust the system. Be patient. If they say wait. It's not overnight, but it is sure. It's a process, but the process surely gets excellent results. So trust the process, trust the team. So if you trust the team, just relax. Forget about whatever social media says. Choose your doctor based on safety.
Yes.
And
Always
then,
put safety.
and I feel like there was a patient for tummy talk. And she started asking me, when is she going to start crawling? Yes, I believe she was told that at a certain, after some days you have to crawl on the floor.
Then you start walk stepping.
that.
Yes, so she was so sure about it that what stage is she going to get. So I believe it's, I don't know if she read it or she was
a lot of information out there.
Yes, so be careful of
what you ingest,
what you take in, because some, and I think the pain people feel at times is psychological, because they already set their mind that
because that's what they've seen online.
Yes, pain is going to. They'll say, when am I going to start feeling pain? In fact, I had somebody that was on the call and started, the pain is going to come. The pain is going to come. The pain, and she started, at a point, she started complaining of pain, and placebo was given to her, and she was all right.
She was actually not in pain.
Yes, so she had a lot of she has read a lot of things, and had, aside from what the doctors have told her, she has read a lot of things, has had a lot of information that do not correspond with how
it's supposed to be.
So I feel what you ingest before coming for the surgery is very important.
That's why Dr. Malu always say, go to a plastic surgery page. Don't just open anything you see online and start watching, because it can actually affect what you're going to feel or believe.
Great. So what do you have to say yourself?
Okay, so for me, right, anybody considering surgery, I always tell them the first step is choosing the right surgeon. Right. If you don't do that, every other thing is going to go wrong. But once you get that step correct, every other thing follows. Because once you choose the right surgeon, the pre-op care, intra-op, everything is going to be aligned, because your surgeon will know that no two persons are the same. You are different. Example, let's say you're asthmatic. Your care is going to be different from somebody that is just without any medical history. All of those will be put into consideration, and then at the end you come out very well. So I feel that is the most important step, choosing the right surgeon.
Yes.
Yeah, so in summary,
wow, this was really interesting.
It's been a wonderful one, and I look forward to talking more about. There's much more that we'll talk about, but we cannot finish it in one session.
Episode.
Yes. So we'll see you again in our next episode. Dr. Joy, thank you for hosting us today.
Yes, thank you for being here. And Nurse Winifred, thank you so much.
Thank you.
So let's run up with our slogan. So the next time you are going to see me, you are going to be on your bed, you will be awake, you will be the best version of yourself, and trust me, you are going to love your results.